Hi, I am Dr. Claudia Cotes and I'm the lead radiologist at the Rose. The Society of Breast Imaging recently published a statement regarding screening mammograms and the COVID-19 vaccine. And I've heard many advising to delay the mammogram screening if you got your vaccine recently. What is happening is that radiologists have noticed increased cases of enlarged lymph nodes in the armpit or unilateral lymphadenopathy in patients who have recently received a COVID-19 vaccine. This is a normal and expected response that can occur in up to 16% of patients after receiving the vaccine, and it is just telling us that your immune system is doing what it's supposed to do. This is not unique to COVID-19 vaccines. We can see this in other types of vaccines, infectious diseases, or even in some inflammatory causes. The workup for patients that have unilateral axillary lymphadenopathy would include a diagnostic ultrasound to see how the lymph nodes look and to discuss possible causes. In most cases, the cause can be determined as a probably benign finding, and then we can do a follow-up study that can be performed in 1 to 3 months just to document that there's resolution of the findings. But there are some cases where no cause is determined, and then further workup, such as a biopsy, may be warranted, because one of the reasons of having unilateral lymphadenopathy can be breast cancer or other types of malignancies. The Society of Breast Imaging stated in their recommendations that, if possible, and when it does not unduly delay care, we should consider scheduling screening mammograms prior to the first dose of a COVID-19 vaccine or 4 to 6 weeks following the second dose of a COVID-19 vaccine. And what I would take from this is that the patient should consider their mammogram screening schedule prior to scheduling their vaccine to try to avoid a possible recall, in the case they're within that 16% of patients that will develop enlarged lymph nodes. But I would not advise to delay the scheduling of the mammogram. I believe the wording matters here. So basically, patients must know that it is important to tell the radiologist if they receive a recent vaccination for COVID-19 when they're getting their mammogram, and to understand that if they did, they might have a 16% chance of being called back because of lymphadenopathy, and then an ultrasound might be needed to clarify this issue. However, we as radiologists will take this information that you give us into account when we're interpreting your study. But since we all know that in each screening mammogram there is a chance of discovering a cancer, if we delay this, the consequences could be more dangerous to the patient. And of course, all this applies only for screening mammograms. If patients have symptoms, for example, a palpable lump, changes in the skin, nipple discharge, pain, they should get a workup for sure, regardless of their vaccination status. So I hope this helps a little bit with this issue. And if you have any questions, please send us a message.